To DTM TV Enyanya, and I am your host Elijah Mero, reporting to you live from the city of Kolding in Denmark, and this is Real Truth. That I want to thank all of you, our followers who have been following us on this our channel and listening to what we have to say and sharing our videos and liking. Thank you so much. We really appreciate whatever you've been doing and the support that you've been giving us. Without that support, we wouldn't be doing what we're doing today. And without taking so much time, let me welcome our guest, Elocho Swed, and I think he will be able to explain and present himself more to you, our audience. Brother Elocho, are you there?
Yes, I'm there.
All right. How are you doing today?
I'm fine. My name is Elocho Swed, and I'm happy to be on this TV problem.
Yeah. We thank God for your presence, sir, and thank you so much for accepting our invitation. We really appreciate your presence and your contribution here today.
You're welcome, sir.
So we quickly want to see what is happening on the continent. Several things we will be talking about. Tanzania, we'll talk about Dr. Jerome Muyembe, and we'll talk also about the president of Madagascar, and finish with what is happening in Senegal and any other discussion. It's just like an open forum. And if you are our listener or our viewer, and you have some comment, you can just leave your comment in this video, and we do everything we can to make sure that we answer all your queries. Now, the president of Tanzania this week just made an announcement, a shocking announcement, that he was worried, you know, he was facing so many critics from so different quarters that he didn't lock down the country as any other leaders who are doing, all the other leaders who are doing in Africa. And immediately there were reports from the country like so many people were testing positive. And then he made this experiment. I made a video yesterday explaining about the same. And there are different reaction about whatever result he had and what is happening in Tanzania. And I want us to start with this. What is your point of view about the whole issue of coronavirus and how the president of Tanzania is handling it, sir?
You know, in Africa now in this 2020, we have only one president.
Only one president.
Only one president whom we can rely on and say this one is working for Africa, is working for his citizen.
I beg to differ. We have two.
Of course, but to my point of view, of course we may have many, but to my point.
Okay. I'll tell you mine. You tell me yours.
Okay. On my point of view right now, I think we have President Magufuli, who is working very closely to develop Tanzania as a country in Africa. Why? Because whenever people take as opinion, they follow the world organizations. Because when the World Health Organization, or do we call it again?
WHO.
Yeah, when they say, please, can you lock everything down in Africa? Can you do lock school? Can you do this? President Magufuli will go in and talk with his own people, will talk with own doctors. What can we do? What kind of things can we do in Tanzania? What things can we lock down, and how can we go on with these things? They will come on with a point saying, if we lock down, what will be our economy? How will we help people? Can we send people home without giving them something to eat? Can we tell people go home and stay home, and we don't have anything to help them with? Is that human? Is that human right which we are talking about?
Yeah, because here where you're talking about, I want just to build on that, because we know that most of the African countries have been living on aid and grants from these Western countries, And now the Western countries' economies is trembling. The economy of America is trembling, which is the bigger donor of funds from outside and who sponsors almost all these world organizations. Now the question is, if the Western countries are not able to help themselves, when the economies of African countries fall because of this locking down all their countries, well, where will they run to?
That is what I was explaining. I was explaining why President John Paul McFully rely on his own expert, because he knows that if he only send all Tanzanians home, how will they survive in 10 years to come or 2 years to come? Will they be able to have all these people in this lockdown? And let me take Kenya. I was seeing a video in Kenya where people want to go out and find something to eat because they live on daily basis, which means...
And that's the case. That's what happens in the whole of Africa. It's everywhere in Africa. People live on hand to mouth, as they say in English, right?
Yes, they live on daily basis. It means when they go out, they will find something out, and then they will take it home. That is what they will eat.
They have no stock in their houses. They don't.
There is no store. There is no store in the house. There is no fridge in the house. There is nothing. They don't even have electricity. But they only go out, find something to eat. They come home and eat. And then you tell that person that you have to remain home because there is coronavirus outside. If you go outside, you will catch coronavirus and you will die. And you are telling that person to remain home
without thinking that they can also die of hunger, right?
Yeah. In 14 days, the experience and doctors said in 7 days a man can die of hunger. And you are telling the person to remain home in 14 days. Then you are telling that person, stay home, kill your family, kill your wife, kill your children.
Because of corona.
That is why I said President Magufuli took a good direction according to the economy of Tanzania and according to the economy of almost all African countries. That's why I'm saying they may condemn him because the Western, every time when there is something good in Africa, they would like to minimize it so that we may see that we don't have self-esteem, that we don't know what to do, that Africans are not clever. You know, I'm doing this is my last year of law in Denmark, and most of the time you meet people, they will think African, they cannot speak 2 or 3 languages.
Yeah.
They will think African, they cannot learn. They will think African cannot stand on their own and do their assignment themselves. You see, and all this, they come up to our president because they think our president cannot stand alone. I encourage President Magufuli, who always refuse when there is an African, or how do you call it again? African English, they call it...
Oh, the English-speaking countries.
You will see the president of France, a president of United States will call all African presidents.
The so-called Anglophone, Francophone, right?
You see, they will come to talk to one man, all African presidents, and President Magufuli will say,
I'm not going there. And he has never attended any of these Russia Africa, US Africa, China Africa, don't know. He doesn't go. He has never attended any of these, right?
And I encourage him to stay there in all these 10 years, which he's going to spend in power. He must not attend any of those conferences, because when you will try to attend,
that's what will be his end.
That is when they will kill him, because there is no one today. There is no president in Africa who stand like President Magufuli and say we are doing this only for Tanzanian. I'm doing this for my country. That is a very important thing to do. Yeah. It's an important thing to do in countries like Africa, because we need leaders who can stand on their own and say, here we can do our own thing.
Here we can do our own thing. Magufuli, then this guy, he refused to do whatever they were telling him, and then suddenly there was news like the coronavirus is going up quickly, and then he was not influenced even with those numbers. Instead, he decided to do an experiment and bring out and see for himself what is happening. So there was shocking result for this experiment that he did, because things like pawpaw, fruits, happen to have coronavirus. Animals like goat and sheep and birds were coronavirus positive. So the question is, what is happening with all these things? And now we understand that even people, when they say they are positive, perhaps they are not positive. Is it that those machines or testing kits were faulty? Is it that they were made like that to fail? Is it that they're coming? What's going on? What's your reading of this happening as far as the experiment that Magufuli did is concerned?
I'm not a doctor, and I cannot talk on the issue of experiment which the doctors took about it. But I want to tell you the only angle.
No, you must understand. It's not Magufuli who made the testing. In Tanzania, perhaps just a brief background for those who didn't watch the video that I did yesterday. I'll put it in the link of this video. I'll link the experiment that he did in this. But what happened was that when he realized that there was this problem with these numbers, he was not sure like these numbers were true. Okay, so he wanted to question on or to verify with facts, as a very good scientist would do. So he talked to the minister of to the Ministry of Health, and together with the principal secretary of the Ministry of Health, they went somewhere, they took sample. It's not Magufuli, neither the Ministry of Health which did that, but there is an agency called in Tanzania which is in charge of this. And this agency which is conducting this testing, they just took sample to them, and these people they didn't know, because they pretended, like for example that they took oil, this oil we use in our cars. They took that oil, they named it, they gave it a name, age and sex and gender, and these people thought that they were testing human beings, and by testing, some of the results were positive, others negative, others undetermined. So it's not like Magufuli is claiming expertise as a doctor, but he was even questioning what those people are doing with their machine. He didn't do it. What he was commenting on was the result that came out from those. So showing like even though people who are going there, who are said to be positive, may not be positive. You understand? So I understand that you're saying you are not a doctor, and I appreciate that. But I'm just saying, based on those findings, what do you have to say about the same?
Yeah, that's what I was trying to explain. I was trying to explain that I am not a doctor, and Magufuli is doing all this with a code with his own expert, which is very positive, because when we start relying on African
expertise,
expert, that is when we will have a lot of our own experiment which we can use. Let me take this thing. All this machine which they are using, the machine may be made in China, may be made in France, or made in England or USA. You see? And when we take this machine to Africa, we don't know what kind of machine we are taking home. But when a time comes that our own doctors, our own experts can go in this machine and try to look at them, what is wrong with this machine, then we will find a lot of fraud. I'll take you back to Congo in this aspect. I'll take you back to Congo. Last time there was rice they send rice in Congo. And in this rice, they were sending it somewhere.
Yeah, before you continue, I want you to listen to this report done by an Indian lady with relation to these kits which are being sent, I don't know with which country, to test the coronavirus. I want you to listen to her. Perhaps it will add up to what you're saying. Listen to this. This is a lady in India reporting about the issue of these testing kits. Listen.
India's rising numbers tell a story, and the villain of the story is turning out to be China. First it sent the virus, and then faulty test kits that couldn't detect the virus. Surprise, they turned out to be faulty. You have to listen to how bad this is. Less than 6% of the test kits work properly. Only 5.4% give accurate results. In other words, 94.6% of the test kits from China are faulty. 94.6. India should have seen this coming. The world over, countries are complaining about unusable Chinese equipment. WION was the first to report these stories. We showed you how companies from China have supplied faulty testing kits, masks, even personal protection equipment or PPE. Last week we told you about how India ended up with faulty PPE kits. These too were Chinese, but they were part of a donation. Now India has fallen victim to faulty Chinese testing kits, something that the government had bought from Chinese suppliers. Tonight on Gravitas, we have compiled the most definitive report about this scandal because the world must know how China is setting back the global fight against this pandemic. First, let me tell you what happened today. Indian health officials held their daily press conference. They said Chinese kits are not working and that there is a quote-unquote huge variation in the test results. So states have been advised to stop using Chinese kits for the moment. And here we would like to draw your attention to one man in particular. He is Dr. R. Gangakhetkar. He is a senior scientist at the Indian Council of Medical Research, the ICMR. Last week, he was asked about these Chinese kits. Should India be buying them? That was the question. The response was a bit roundabout, but the essence of what he said was this. Dr. Gangakhetkar said that results were not perfect. The terms he used were sensitivity and specificity. He said these were low for the Chinese kits, meaning they weren't the most accurate. But he also dismissed concerns. He said that we were just using these kits to check trends. That was 5 days ago. Today he says that the same kits are giving inaccurate results. And we've pulled out both the statements for you.
This is in support of what Magufuli did, you know. Magufuli shows that these kids had a problem. Now we are having reports from India, and this Indian journalist is saying it's all over. Even those European countries which tried these kids, finding them also to be faulty. Was it by design? Was it by accident? What is happening here? That's my question and my concern.
That is what I was saying. When African will start relying on African, like Africans can do something good, expert from Africa, they can check the kits from different countries and say, we can use this thing. Then the machine which we are using, the kits which we are using from different countries, are they good for us? Because the only thing we have to understand also is like this. We have a different color of skin than those in India, those in England, and those in the United States. And
meaning?
Most of them they are saying that this pandemic, which they are calling it, is not so much in Africa. But how can they now punish us? They can punish us through this kit which we are using. That is why relying on our own expert will help us to determine whether what we are using are correct or wrong. That is what Magufuli did. Is one of the experiments which other countries has to cope, because whenever we believe on the Western, whenever we try to put our trust on other people, that is where African are suffering from different disease which we cannot explain. Look at HIV. HIV, it was now in Africa that Africans only are having HIV.
What?
We didn't create those things. Look at this coronavirus, which started in China, and the only thing you will hear on TV, it was only that Africa is going to die. Africa
will be hit hard, they are saying. Why? Why should we hit hard?
The only thing that they are expecting is that they are expecting that African can be affected with everything that is bad.
So the words of Magufuli are correct then, because he was saying when we get all these things, we need sometimes to question and ask ourselves what is the intention of the people who are giving these donations. Because sometimes it can be sabotage, as he said.
You know, whenever you get a donation from a person, my dear, look, if I meet you, you are hungry and you need something to eat, I give you something to eat. You eat it without asking question because you are hungry. And if there is a poison in that what I have given you, you are going to die, isn't it?
And you'll not have an opportunity to ask a question when you are dead, right?
You see, you not have an opportunity to ask questions when you are dead because you are already dead.
Yeah.
So the question is, what Magufuli is saying is what we need to tell all African presidents, and is what we need to tell all Africans working with these kids, that whenever they get them, let us have time to test them. Let us make a group of experts which can be there. Their work is not to treat, but their work is to look, what can we use this as African? What is the effect of this thing? Because if Magufuli now says, God, they are getting this coronavirus, and you are telling people to lock down, to be at home, when these people, most of them, they have gods at home, they have oil at home, it means the whole house will get coronavirus. If we don't have expert, if we don't have
but expert we have, I think what is happening in Africa today is showing us that we have expert. And this will lead us to the question of Dr. Muyembe. But before we go to Dr. Muyembe, there is a good news. A very, 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 very good news, I would say, happening in Senegal. I don't know if you are aware that in Senegal, the young people, entrepreneurs of Senegal, have been able to make their own testing kits, which are able to test if you have a coronavirus or not in less than 10 minutes, and it only costs less than $1, right? It's made in it's made in Senegal. And now I hear France is complaining and blah 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 blah. But the intelligence we have in Africa is not like we don't have brains. We have brains, only like leadership. And so this is good news. So instead, those who want those kits, the same way they are doing about the COVID organic, they should go to Senegal, and that's what we should be doing. Already we have Madagascar giving us the drug, and now we have Senegal giving us the testing kits. So we don't have to import them from Europe or from America or from China. We have them in Africa.
African. But let us go back to Dr. Jerome Muyangi, the Congolese guy who found this medicine in Madagascar.
The COVID organic, as we call it.
Yeah, years ago, he was on YouTube explaining an experiment which he made about finding a certain medicine for a certain sickness.
No,
and today
he was explaining about the medicine that he found for paludism or for malaria, if you like, and yeah.
Thank God you followed it. And now the doctor himself, he said, first of all, he contacted the Minister of Health, the Congolese Minister of Health, explaining all this, that he want to try this medicine which I found for COVID-19. They refused. He also said that he contacted the Dr.
Mukwege. Mukwege, the Nobel Prize winner.
The Nobel Prize winner, he contacted Dr. Mukwege and explained, but Mukwege didn't give him away. What did he do? Instead of coming to Europe, explaining it, he went to Madagascar and explained to the president, to the minister of Madagascar, and they give him a chance to show himself. You know, if we take now the spirit of the president of Madagascar, if we take that spirit...
That's now my president. Apart from Magufuli, that's my second president. A young president who first became president at the age of 34, and now he's only 45. He will be turning 46 in this month. So at the age of 46, I think this is the breed of leaders that we need. This young president, the last born of the presidents of Africa, as they call him, he was able to stand against the World Health Organization. He didn't care about the repercussion, about the consequences, but he stood up as a man and said, we have a cure here. I think this guy needs our round of applause, right?
Yeah, of course. We need a president like him. We need a president who can stand.
We need to support these kind of people, right?
Huh? Yeah, we need a president who can stand and say, we have experts in Africa and we have to trust this expert. Look at what this president did. This president accepted a Congolese. He's not even from Madagascar. He's from Congo, where they rejected him.
But science does not have nationality. And this stupid thing about nationality, Congolese, Madagascar, we didn't have all this stupid stuff in the first place. We were Africa. And I wonder even how were they able to divide us? Because they colonized India. They didn't divide India. They colonized China. They didn't divide China. But they only divided the Congo and put us in these groups called the Francophone, the Anglophone, the Lusophone, and so on and so forth. So him not considering this lawyer, not thinking about this doctor as Congolese, he was right. Because once you are African, you are African. It doesn't matter you are in Madagascar or you are in Congo or you are in Tanzania or you are in Madagascar or Nigeria and I think that's the spirit that we need to take, and I think that's what led him. Or what do you think?
Yeah, you know, his understanding of things is very different from other presidents. And I like the spirit. I like the spirit which he has shown to the Africans. I'm not saying to the world, because the world will not trust in us if we don't trust in ourselves.
We don't give a damn. If we trust ourselves, that's the most important thing.
People like the president of Madagascar who can trust in young Africans who can do their things. Today I heard, I was seeing the conference of president, where President Felix Tshisekedi is now congratulating the president
of Madagascar, for heaven's sake. For a son of his, a Congolese guy, this medicine would have been in Congo, right?
Yes, you see, and this guy contacted them, but they despised this guy.
Welcome to Dad.org. Dad.org is a platform for buying and selling anything, anywhere, anytime. So, making money the really, really easy way. In fact, it's easier than falling asleep.
It's swift, secure, and easy. Dad.org, transforming lives.